So, let's dive into the topic of anxiety disorders and, how truly widespread they are. It's staggering, really. According to global estimates in 2019, around 301 million people were living with some form of anxiety. If we bring it closer to home here in Australia, 17% of Australians have reported experiencing anxiety. That's nearly 1 in 5. It's really significant, isn't it?
Absolutely, especially when you consider that anxiety disorders don't just appear out of nowhere. They're complex and often develop early in life, during childhood or adolescence. And when untreated, they can persist into adulthood, leading to, real disruptions in functioning, be it in relationships, work, or even simple daily activities.
Right. And I think it's important to acknowledge that anxiety itself is not inherently harmful. It's kind of our body's way of responding to threats, that fight or flight mechanism. But the difference when we're talking about these disorders, generalized anxiety disorder, for instance, is that the worry is excessive, uncontrollable, and chronic. It's like the brain is stuck in overdrive.
Exactly. With GAD, people deal with constant worry about things that might not even be imminent threats. The DSM-5-TR criteria state that this worry has to last at least 6 months and must interfere with daily life. Plus, they usually experience at least 3 related symptoms. Things like muscle tension, difficulty concentrating, or, just feeling on edge all the time.
And then there's panic disorder, which is so different, isn't it? It's not about ongoing worry in the same way.
Yeah. Instead, it's about sudden, intense bursts of fear. Panic attacks can come out of nowhere, and they're unbelievably debilitating. Symptoms include things like a racing heart, dizziness, sweating, and even a sense of impending doom. It's all about what feels like a catastrophic loss of control.
And so often, these conditions relate back to neurotransmitter activity, don't they? Like with GAD, we see dysregulation in GABA, which is the brain's primary calming neurotransmitter, and norepinephrine, which is involved in that stress response.
Spot on. When there's a lack of balance in those systems, it's as if the brain is just misfiring signals, kind of like an overactive fire alarm, and that triggers the symptoms we see in both GAD and panic disorder. What's fascinating, though, is how much we can do to intervene, particularly when you bring in non-pharmacological treatments.
Yeah, I'd love to talk about that, actually. Cognitive behavioral therapy, or CBT, is widely regarded as the gold standard for anxiety disorders, isn't it? It's all about identifying those distorted thought patterns that keep people stuck in cycles of anxiety, then slowly replacing them with healthier ways of thinking.
Absolutely. And exposure therapy plays a similar role. It's about helping individuals confront the specific triggers of their anxiety in a controlled, step-by-step way. Take someone with social anxiety, for instance. Gradual exposure to social situations can eventually reduce the fear response over time. It's like building resilience incrementally.
I've actually seen mindfulness practices work wonders in anxiety treatment as well. It helps patients focus on the present moment rather than spiraling into what-ifs. I had a patient once who used to really struggle with catastrophic thinking. They found guided mindfulness sessions, combined with breathing techniques, transformative in calming their racing thoughts.
That's such a great example. It really highlights how different approaches can work together. While pharmacological treatments like SSRIs might target the chemical imbalances, these behavioral and mindfulness strategies help patients reclaim control over their day-to-day lives.
Absolutely. And that blend of approaches, tailored to each individual, really seems to be the key to effective treatment. That blend of approaches we discussed for anxiety, the mix of medication, therapy, and mindfulness, becomes equally important when we shift focus to affective disorders. Take major depressive disorder, or MDD, for instance. It's one of the most debilitating conditions a person can face, and it's not just about feeling sad, as people often think. MDD is tied to physiological changes in the brain, particularly neurotransmitter dysregulation involving serotonin and norepinephrine.
Yeah, and those neurotransmitters play an integral role in regulating mood. When serotonin and norepinephrine levels drop, you see symptoms like persistent low mood, fatigue, and Well, that classic loss of interest in nearly everything. It affects cognition too. Things like concentration and decision making can take a serious hit.
Absolutely. And the pharmacological options we have often target those very systems, don't they? I mean, selective serotonin reuptake inhibitors, or SSRIs, are usually front and center. They're designed to increase serotonin availability in the brain by slowing its reuptake. But of course, they're not without their side effects.
Exactly. While they're generally more tolerable than older antidepressants, we still see things like nausea, insomnia, and sometimes even changes in libido or appetite. And patients need close monitoring, especially during the first few weeks, to assess for side effects or, worse, an increased risk of suicidality.
And bipolar disorder takes the complexity to a whole other level, doesn't it? With bipolar I, for instance, the mood shifts between these extreme manic highs and depressive lows. And during mania, people can engage in risky behaviors with very little regard for the consequences. It's like, they're running at full speed with no brakes.
Right. And that's why mood stabilizers like lithium are so vital. Lithium's effect on mood regulation is honestly unparalleled, but it's not without challenges. Its therapeutic window is narrow, so patients require regular blood tests to ensure levels remain safe. And, of course, there are side effects like tremors, weight gain, or even thyroid dysfunction if not monitored properly.
I actually had a patient once during an emergency shift. They were admitted in the middle of a manic episode, completely impulsive, hyperverbal, and just physically drained. Pharmacological stabilization was essential, but what really stood out was how the multidisciplinary team came together afterward. From psychology to social work, everyone worked to ensure the patient didn't just stabilize, but had a long-term care plan once discharged.
That's such a valuable point. It's not just about treating the acute symptoms, it's about integrating care across the board. And with bipolar disorder, ensuring consistency of treatment makes a massive difference in preventing those relapses, whether it's through medication, adherence, therapy, or even lifestyle changes like structured sleep patterns.
It really all ties back to the idea of personalized care, doesn't it? Because while the mechanisms behind these disorders might seem straightforward when we talk about serotonin or dopamine, every patient's journey looks so different. And that's where the real challenge and reward lie in treatment. Building on that idea of complexity and personalized care, psychotic disorders, and particularly schizophrenia, present challenges on an entirely different level. For patients and their families, coping with symptoms like hallucinations or delusions and maintaining some sense of stability can feel incredibly overwhelming. But when we delve into the science behind these symptoms, it starts to shed light on their origins, doesn't it?
Absolutely. At the heart of schizophrenia is dopaminergic dysregulation. It's that overactivity in pathways like the mesolimbic dopamine system that leads to positive symptoms, like hallucinations and delusions we often hear about. But then, the negative symptoms, things like a lack of motivation or emotional flatness, might come from underactivity in other areas, like the prefrontal cortex.
Right. And I've seen, firsthand, just how hard those negative symptoms can make it for people to engage in day-to-day life, or even in treatment at all. It's not just the obvious symptoms that take a toll, is it?
Not at all. Negative symptoms can be every bit as debilitating as the positive ones, if not more so. And that's where treatment often centers on trying to restore some balance, primarily using antipsychotic medications. They're the cornerstone of symptom management for schizophrenia.
And those medications, they're pretty powerful, aren't they? Especially the newer, second-generation antipsychotics, which tackle both positive and negative symptoms. But they're not without their challenges. Patients often struggle with side effects like weight gain, sedation, or even more rare but serious problems like metabolic changes.
Exactly. It's one reason why ongoing monitoring is so critical. You've got to balance the benefits of symptom control with minimizing the impact of side effects. And for some patients, long-acting injectable antipsychotics can be a game changer, especially when compliance is an issue.
Absolutely. And I think this is where a multidisciplinary approach is essential. It's not just about the medication, It's about combining that with something like cognitive behavioral therapy, or CBT. That can make such a difference in helping patients address distorted thinking patterns and manage delusions or paranoia in a constructive way.
And CBT also helps with insight, which can be a big barrier to treatment. If someone doesn't believe they're unwell, sticking to a plan, whether it's medication, therapy, or anything else, becomes even harder. But when you combine those interventions with practical supports like case management or social work, the outcomes can really improve.
You know, I once worked with a patient who'd been cycling in and out of hospital due to schizophrenia. The big turning point for them wasn't just finding the right medication. It was introducing structured outpatient therapy with a focus on reintegrating into their community. They started small, managing appointments and eventually volunteering. Over time, they got their confidence back, and it was incredible to see.
That's such a great example. It really shows how the combination of clinical treatment and broader life supports can pave the way for recovery. And for families, equipping them with education about what to expect, how to offer support, can be just as critical as treating the patient themselves.
Because mental health care is as much about compassion as it is about science. It's about meeting patients where they are, understanding their unique experiences, and building trust so they feel empowered to take the next step. I think that's the heart of it, really.
Couldn't agree more. And for anyone listening out there, whether you're a mental health professional, a family member, or someone who's personally struggling, know that recovery is possible. And it's not always linear, but with the right support system, progress is always within reach.
And on that note, we're going to leave it there for today. Thank you so much for listening and joining us on this journey through mental health disorders. We hope this series has offered some clarity, some hope, and maybe even a little inspiration. Take care, everyone.